So for this week, my assignment was oxygen delivery systems and tracheostomy, putting together a discharge plan. So for a discharge plan, I would assume the reason for the visit would be at the top of the discharge plan, which would be a oxygen delivery system following a tracheostomy. A tracheostomy is a surgery that creates a opening through the front of your neck into the trachea. A tracheostomy tube is usually put through this hole onto the windpipe. However, the word tracheostomy is commonly used to describe both the surgery and or the tube. The tracheostomy tubes allow people who cannot breathe on their own to connect to a ventilator, which is a breathing machine, or receive additional oxygen. It also allows air to bypass an injury or blockage in the upper part of the windpipe to reach the lungs. I've also provided a diagram to the right of the text, just showing you kind of like what it looks like. In order for a patient to be discharged, this kind of seems like the general consensus on all the research I did. The criteria would be that the patient is medically healthy, the rehabilitation goals have been achieved, arrangements have been confirmed with home health services, and initial home support is available from a family member or a caregiver. Again, from all the research I did, it seems like the number one discharge instruction is to call 911 or have someone else call 911 if any of these following issues occur. If the patient has trouble breathing after suctioning, cleaning, or changing of the trach tube, if the patient coughs up bright red blood, if the patient cannot insert a new trach tube, if the patient stops breathing, or if their lips turn blue. So the main reason for the visit was the oxygen delivery system. So I thought it would be important for the patient to have some education on oxygen therapy, which is the administration of oxygen at concentrations greater than the ambient air, with the intent of treating and preventing symptoms and manifestations of hypoxia, which includes agitation, personality change, headache, nausea, increase in pulse, increased frequency, or shortness of breath cyanosis. The supplementary role of oxygen is to prevent the prevention of cellular hypoxia, which is caused by hypoxemia, a low O2 stat. So then just going further into the education, patient's need for the oxygen therapy is based on the specific clinical condition. So in this case, the patient, just had surgery, and what are normal oxygen saturation levels. And usually this also depends on the facility and what they want the oxygen saturation level to be at. And then I just go into different forms of oxygen delivery equipment. So we have the nasal cannula, which I've provided images for all of the different types of equipment. The nasal cannula can be used for a flow rate up to 2 to 6 liters per minute. And then I just list some of the advantages, which include comfort, easily tolerated by patients. It's a low cost. Then you have the simple face mask. It is a variable performance device, and you can use concentrations between of a flow rate between 5 to 10 liters per minute. Then you have the Venture or the fixed performance mask. That one has the delivery constant oxygen concentration. It's the colored coded nozzles for the exact concentration of oxygen the patient is supposed to be on. So here it shows, and I've broken it down in the text and also with the picture. The blue would be 24%, the white would be 28%, the yellow would be 35%, which is actually in the tube. The red, or I guess pink, is 40%, and the green is 60%. There's also the high concentration reservoir. commonly known as the non-rebreather reservoir mask. And then I also show, because this patient specifically had a tracheostomy, the tracheostomy mask for patients, and how you can just place the mask over the trach and connect to the oxygen. So I also included some oxygen safety along with visual aids. Do not use oxygen around heat or flame. Compressed oxygen can catch on fire. Keep the oxygen container 5 feet away from open flames or heaters, such as candles or hot water heaters. Do not use anything flammable, such as cleaning fluids, gasoline, or aerosol sprays. Keep a fire extinguisher in case of a fire. Also, along with the education, I included do not smoke while you're on oxygen. Do not let anyone smoke around you. Do not change the flow of your oxygen unless your healthcare provider tells you to do so. Don't drink alcohol or sedatives while using the alcohol, as this may slow down your breathing. Put signs on your door. Provided an illustration of a sign you can use to let people know. You can also let your electrical company know. And then just follow the instructions and maintenance of the oxygen equipment. For a follow-up, the patient would follow up with the healthcare provider as directed, especially if they have any new or worsening symptoms. The provider may want to do a follow-up blood work with the follow-up appointment, just to make sure everything's working the way it's supposed to, reassessing the patient. They might want to do a CBC to check for any anemia, low red blood cell count, or any signs of infection with a high white blood cell count. They definitely want to check atrial blood gases to evaluate the respiration and metabolic status, and the oximetry to monitor the oxygen level in the patient's blood.